Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yos pispiataya posnapi notaman e ne hisikimaka e yoso matnamin kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. We would like to remind people to send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Hi, guys. Happy Friday.
Happy Friday. So I would also like to remind people that we have National Guard COVID-19 testing taking place here in the community at the Highway Department, right?
Transit, yeah.
Transit, okay. And that is November 10th from 10 a.m. to 6 p.m. and that's open to everybody. So anybody that wants to get a test, come on down. So Vaughn, yesterday, there was a record number of new cases per day in the U.S., and locally, cases seem to continue to rise. So what levels of spread would we see in order to trigger another shutdown for the tribe?
So over the last few months, the tribe's spent a significant amount of time, energy, and finances making sure, the offices of the tribal offices are safe for employees to work. In addition to that, they've kind of reached a point where economically we need to bring a lot of people back. So the incident command team is going to be watching the 14-day moving average of how many new cases we have, among that with some other metrics and stuff about number of new cases, severity of cases. They're going to watch the number of available hospital beds and things like that. So it's kind of, I don't want to say it's a mesh right now, but it's kind of based on all of those factors grouping into one. If we have a rising number of cases, but not a lot of people are being hospitalized, if they're not very severe, that probably won't trigger a shutdown. If we have a lot of people that are experiencing a lot of severe symptoms, that could actually require our doctors to spend more time in the hospitals, and we might shut down in that kind of event. But there's not really one thing we can stare at and saying this is our triggering point for a new shutdown. We're going to do as much as we can right now to make sure the tribe can function. We know there's a lot of community spread right now. We know the virus is here. And so we're really going to focus on being able to function in spite of that and try to keep everyone as healthy as possible. So I wish I had a better solid answer for you, but right now it's kind of a moving target for us.
Okay. I also have seen some community members criticizing the fact that local businesses, at least in their eyes, are not enforcing a strict mask rule.
Yeah.
So does the tribe have the ability to ensure that these rules are being followed in the businesses?
So we've gotten similar complaints and stuff that there are organizations that haven't been complying with mask usage. I know a lot of organizations have been trying to maintain social distancing, but the masks still remain to be an issue. So right now the tribe is actually looking into some of the legal recourse it can take towards private businesses that are technically on tribal land, and enforcing those mask mandates. Because right now the tribe has a mask mandate, and the state of Wisconsin also has a mask mandate that's enforced until I believe it's November 21st. So regardless of whether you're a tribal member or not, if you are in public right now in the state of Wisconsin, you should be wearing a mask, with minor exceptions. If you're under the age of 5, if you have a breathing condition, pretty much everyone should be utilizing masks when they're in public, especially if they're going to be in a place of business and interacting with individuals. So we're kind of exploring those options. We're looking into them. And I don't believe I'm at liberty to talk too much more about that particular situation, but we are looking into it.
Okay. So do people need to wear masks even after they've had COVID-19 and they've recovered from it?
So that is actually a giant question mark right now. This week, Dr. Schlegel indicated that we did have a patient on the reservation that looks like they have been reinfected with COVID-19 even after recovering. So should they be wearing a mask? Very possibly. We don't have any sort of double-blind studies, but anecdotally, if someone can get reinfected, they probably should be utilizing a mask just so they're not spreading the virus in the community.
And then can you go over some of the kind of basic definitions that we hear around COVID-19?
Yeah.
Like positive case, direct contact, isolation?
Yeah, so there still is questions about, what some of these definitions are technically. When we're talking about, positive case, that's someone who's either been tested by a medical professional and it's been confirmed that they have the virus, or they've been diagnosed with it based off of their symptoms, particularly things like a lack of a sense of taste or smell, sore throats, coughs, fevers happen in a lot of those cases. So those are some of the things that can lead to being diagnosed as COVID-19. So it's someone that's essentially had a medical professional verify that they do have it, either by test or by symptoms. With that said, another thing that people need to think about is what direct contact is. And that's any time you come into contact with someone that has a positive diagnosis or is a positive case of COVID-19. A lot of people are exposed when they're at home to other family members that may be positive. It's hard to avoid that. We understand that. When we're talking about direct contact, it's when you're within 6 feet of someone that has a positive case for 15 minutes or longer. And that's 15 minutes of cumulative time. So if you're by them for 5 minutes, walk away, come back, an hour later and are by them for another 5 minutes, you're at 10 minutes cumulated time. So if you have 3 interactions with them, 5 minutes apiece, even if it's, essentially spread over 3 hours, that still counts. That still is a direct contact. And you still are at risk of contracting the virus. This is terrible, but I actually heard of a specific school district, not in Wisconsin, fortunately, that they thought they were meeting in person, and they thought by having their kids get up and walk around the classroom and choose a different seat every 14 minutes, then they weren't having 15 minutes of direct contact. I thought that was horrible, and it was kind of like a virus soup because they're basically just all walking through where everyone is just breathing. So it's accumulated time, not specifically to one place. Some of the other things that we should definitely talk about are the terms isolation and quarantine. They're coming up quite a bit. Isolation is used when we're separating individuals who have either tested positive or had symptoms, and we're trying to remove them from a general population to make sure they don't transmit the virus to others. If you're in quarantine, though, you're either a healthy person or you're symptom-free, and we're removing you because you've come into direct contact with someone that has a positive case. And so that way, we're trying to make sure that if you do come down with symptoms, you aren't spreading the virus, because you can still spread the virus when you're asymptomatic or not showing any signs. So those are some of the things that, we really need people to understand, that, just because you're quarantined, it's not a reflection against who you are as a person. Doesn't mean you're a bad person. We're just trying to make sure that everyone else in the community stays healthy. Isolation, same thing. It's unfortunate you may have contracted COVID-19, but we really need your help in stopping the spread of the virus and having yourself, kind of cloister yourself away for a little while and limit the interactions you have with individuals. So those are some of the main questions that I've been getting about, what the definitions mean right now. So that's what those are.
So how does a person know that they're not infectious anymore once they've been confirmed positive case?
There are a couple different measures for how they know they're not infectious. Usually it's a cessation or symptoms have stopped. They like to have you wait at least 10 days. Under some protocol, they have you wait 14 days from when your symptoms stop. And at that point, they say you're no longer infectious. I know with some of our essential workers, we have them come back a little bit before that, but and in those cases, it's, essentially several days after a fever, but a fever isn't always present, and so that's not a reliable symptom to rely on to say, I'm not infectious anymore, I'm not hacking or coughing or sneezing, and I don't have a fever. You may not have had a fever the entire time, but you could still be infectious to others. So usually we have people wait 10 to 14 days after their symptoms resolve themselves.
Okay, so I've been seeing pictures on social media, and I was kind of wondering what is being built in the parking lot at the clinic.
So we have 2 projects going on over at the clinic right now, and so it depends on which side of the clinic you're looking at. If you're on the dental side, they have a small facility erected, and that's for the pharmacy employees that are running medications to and from the parking lot to keep patients out of the building as much as possible to lower their risk of exposure to COVID-19. On the other side of the clinic is actually where we're erecting a small self-contained test site for COVID. We're doing that so we can kind of limit the exposure of the rest of the building to anyone that potentially has COVID-19. That way we don't have to, tape off the entire wings of the building and stuff if someone accidentally walks through and is COVID positive. So they're establishing kind of a small area that'll be heated, have electricity, and individuals can be tested there throughout the winter and stuff for COVID.
Okay, and then will the tribe continue to allow employees to work virtually even after the pandemic?
So I've been talking to tribal administration, and that's something that is still being discussed. Definitely in some cases, they're going to allow for remote work, particularly when there's things like, winter weather that's difficult to travel in. Long term, it is cost effective, and we have experience with it now. But there are a lot of connectivity issues with the internet still in various parts of the reservation. So they're not gonna, carte blanche say everyone can work remotely. And so it's something that is still being worked out for the long-term usage of tribal facilities and operations.
Charter, come through.
We're working on charter. Actually, I just spoke with community development, and we are moving forward with the cell tower project at a pretty good pace right now. The archaeology has approved all the sites. Right now, we're getting approval for installation of the electrical cable, essentially, that'll power the towers. And MTE has gone through and has surveyed all the trees and stuff for all of the sites. The last step before we start building is environmental impact, and we're doing those studies right now. Hopefully we'll be able to finish that up like at the very beginning of the year. I know it's a couple months off, but that's still pretty quick. And once those are completed, we'll be able to go straight into construction. So we're working on that connectivity issue. We're trying to bring internet to the rest of the reservation, so it's reliable and helpful for everyone. So we're moving in the right direction with that too, fortunately.
Can you say which towers would be constructed first?
Some of the towers that require electricity are going to take a little bit longer to install because we have to do a lot of digging and installation of cables. Some of the towers are also going to be utilizing funds from like the CARES Act, and so those had priority move forward on them. So I don't know the exact order that they're going to be putting them in now. So no, I can't. I'm sorry.
Okay. Thought I'd ask anyway.
I applaud the effort in asking it. It's worth a shot.
So is there any updates on COVID-19 vaccines?
So right now there aren't any FDA-approved vaccines. That said, the FDA is holding all the drug manufacturing companies to the same high standard they would for producing any other type of vaccination. but they are still running through their large-scale testing, which several countries internationally skipped, and now they're finding they're having issues with their drugs. And so we're taking this as quickly as possible, but as safely as possible right now here in the U.S. They're expediting a lot of the paperwork and a lot of the approval process, but the hard science still needs to be done to show that, one, that it's effective, and two, that it's safe. And so none of the drug companies have come out with specific dates saying we're finishing now and we have it ready. There's been conjecture that some of them might be ready by the end of December, but that's still kind of up in the air, and no one wants to overpromise and then underdeliver. So right now we're on hold. I mean, they're working on it though.
Do you have anything else you'd like to add?
You know what? There's good weather right now here in Wisconsin. Get out and enjoy some of the sunshine. If you do, remember to stay safe. If you're going to be around people, utilize masks. Stay 6 feet away. Remember that hand washing and hygiene is super critical for keeping yourself safe and those around you safe. We're all working on this and trying to keep the community as safe and healthy as possible. So, we applaud and appreciate your efforts, and we hope you stay safe this week. Stay healthy.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.